Now, this is putamen, right? But actually, in this diagram, I'm showing only putamen, but when I talk about putamen, it should be considered in association with caudate nucleus. And you know, caudate nucleus with the putamen are called neostriatum. What are they called? Neostriatum, right? And this is of course globus pallidus, right? Now let's start with how the system starts. First of all, when you are going to do movement, cortex should connect with the basal ganglia. So cortical fibers, they come down and they stimulate neurons in neostriatum. They stimulate the neurons in striatum. This is striatum. Again I am repeating. Caudate plus, what is this? Putamen. For motor purpose, most of the fibers go to the putamen anyway. So I will call it now onward striatum, but not corpus striatum, because when we say corpus striatum, it includes globus pallidus also. I will just say striatum. So these are corticostriatal fiber. What are these? Corticostriatal fibers, right? Then from here, very important connections are going to the, what is this? Globus pallidus internus, right? And from there, fibers are going, what is this? Thalamus. And then it should loop back. So what is this? Look here. Fibers start, and this is a very simple loop. Things are going directly back. This is also called direct pathway, right? Now what is direct pathway? We'll talk it later in detail. First of all, what is this? Corticostriatal fiber. Then what are these fibers? Striato-pallidal fiber to the internal globus pallidus internum. Then pallidothalamic fiber. Then thalamocortical fibers. Do you think it's difficult to understand? It's very simple. Now, first of all, I will tell you, when you are resting and not doing any movement, what is going on? First, we should understand, when you are resting and not doing any movement, what is going on in this circuit? And then we'll discuss when movement start, a plan of a movement, you start, right? Then what firing occur? First of all, these red neurons are releasing stimulatory neurotransmitter. Red neurons are releasing stimulatory neurotransmitter. The neurotransmitter released by this is glutamate. What is released from here? Glutamate. And this is also releasing, glutamate. So fibers coming from the cortex to basal ganglia are glutamatergic, and from thalamus going back are also glutamatergic. Now when glutamate is released from this nerve ending to this dendrite or cell body, glutamate receptor will produce cation influx. When there will be cationic influx, this will get stimulated. So glutamatergic fibers will stimulate this first neuron, striatal neuron. Then striatal neuron releases normally what? GABA, gamma aminobutyric acid plus substance P. This neuron, when this neuron is stimulated, its nerve endings release gamma aminobutyric acid along with the substance P on the neurons of globus pallidus internus, right? So this neuron should be considered GABAergic neuron. And the next neuron in the line, which is concerned with the pallidothalamic pathway, that is also GABAergic neuron. What is that? That is also GABAergic neuron, and again glutamatergic. Now, first of all, I will tell you what happens when you are not doing the movement. When you are not doing the movement, these corticospinal fibers which are going to come down, you know this fiber which was coming down. Let's suppose I show that fiber here. Here I show corticospinal fiber. Of course, they are going down and lower motor neuron going out. Is that right? To a muscle. Now, when you are not doing any movement, it means these neurons are not firing. Is that right? It means motor cortex is over functioning or under functioning when you are not doing the movement. Look, throughout the lecture we will use the logic. When you are not doing the movement, motor cortex here should be under functioning or over functioning? Under functioning. It should be inhibited. Is that right? Actually, how it is kept inhibited when you are not doing the movement? Actually, when you are not doing the movement, when you are at rest, globus pallidus internus is actively firing when you are not doing the movement. Globus pallidus internus is actively firing. When globus pallidus internus is actively firing, it is releasing GABA on thalamus. On which nuclei of thalamus? Basically, the nuclei of thalamus is ventro-anterior nucleus, ventrolateral nucleus, centromedian nucleus, dorsomedial nucleus. But anyway, listen. What I'm going to tell you that normally when you are at rest, you are not doing any movement, pallidothalamic fibers are very active. Right? These pallidothalamic fibers are GABAergic fiber, GABA releasing fibers, and these fibers are releasing a lot of GABA in ventro-anterior nucleus of thalamus, ventrolateral nucleus of thalamus, and dorsomedial nucleus of thalamus. Is that right? Now, when GABA is released on these neurons, gamma-aminobutyric acid is stimulatory neurotransmitter or inhibitory? It is inhibitory, because when GABA is released on a neuron, GABA receptor either allow the chloride influx and make the neurons very hyperpolarized, or GABA receptor allow the potassium efflux, and again loss of potassium makes the neurons very hyperpolarized. So what happens? Gamma-aminobutyric acid is normally released by pallidothalamic fibers, right, tonically in very high amount when you are resting, and they keep the thalamocortical fibers inhibited. You are understanding? When these neurons will be inhibited, so naturally can they stimulate this? No. So movement will not be there. You understand it? This is what is happening at rest. Can you repeat it? What happens at rest? Say rapidly. There is a heavy firing by pallidothalamic pathway, which are GABAergic fibers, releasing lot of GABA in ventro-anterior, ventrolateral and dorsomedian nuclei of thalamus. GABA inhibit these neurons. Then what happens? Thalamocortical fibers are inhibited, no action potentials. So these fibers do not stimulate the upper motor neurons, pyramidal neurons going down to the lower motor neuron. That's right. Now, you are resting, suddenly a nasty idea came to your mind and you decide to make a certain movement. You're going to do certain movement. I will not tell what movement, but certain movement. Now, if you're going to that certain movement, what will happen? First of all, you need to consult basal ganglia. Secondly, this is automatic brake applied on the basal ganglia. Basal ganglia is keeping an automatic brake on the motor system that should be released. So exactly what happened. When you think of a movement, right, let's suppose these neurons plan a movement and they stimulate this. Now corticostriatal fiber will come. Now corticostriatal fibers are releasing what thing here? Yes, please. Glutamate. Glutamate will stimulate the striatopallidal fibers. Now, when these fibers are stimulated, listen, glutamate receptors are present here, right? And glutamate will bind here, cations will be loaded, and this neuron will become active. Action potentials will move through and then release here GABA. So this first blue neuron, striatopallidal fibers, release GABA on pallidal neurons. When they will release GABA on the pallidal neuron, these pallidal neurons, globus pallidus internus neurons, will be stimulated or inhibited here? Inhibited, right? So let's put it like this. First of all, these neurons are stimulated. When you are planning to movement, they are stimulated. Their activity is going up. And when their activity is going up, what they release here? Glutamate. When they release the glutamate here, what happens to activity of this neuron? It goes up. So these are also, yes, stimulated. And when these neurons are stimulated, striatopallidus internal neuron, they release what substance here? GABA. And when they release GABA, what happened to this neuron? Pallidothalamic pathway. There are two important pathways here. One is ansa lenticularis, other is lenticular fasciculus. But anyway, important thing is concept here. When first inhibitory neuron inhibit the second blue neuron, right? Now this will be inhibited. So action potential in this neuron will be more or less? Less. So what happened? Activity become less here. When activity become less here, then thalamocortical fibers are released from the pallidal inhibition. Because when you were resting, these fibers were too much firing and keep the thalamic neurons inhibited. But now when you decided to make a movement, cortico-striatal fiber, which are glutamatergic, stimulated the globus internus fibers. When these fibers got stimulated, they released inhibitory neurotransmitter on pallidal neurons, and pallidothalamic fibers get inhibited. And when they get inhibited, then there is less GABA release. Attention please. When these fibers get inhibited, less GABA released in thalamus. So thalamic neurons are less inhibited, or you can say they are disinhibited, or they escape the inhibition. Is that right? So when they escape the inhibition, they start firing, and message goes, yes, message goes to upper motor neurons, and they are stimulated, and fibers go down, lower motor neurons are stimulated and muscle contract. Any question up to this? What is the role of thalamus here? Thalamus is acting as a relay station, right? That relay station, number one. Number two, very important thing. Thalamus has very intimate relationship, even though it is at distance, with the cerebellum. There are a lot of, you can say, fibers coming from cerebellum to eventually, through multiple relay, to the thalamus. So thalamus knows the information in the cerebellum. And information in cerebellum is what is the proprioceptive position in the body. Cerebellum knows which muscle is in, which muscle or which joint or which tendon or which ligament is under what type of proprioceptive situation. What is the degree of bend at joints, or what is the degree of tension at muscles or ligaments or tendons. This information from cerebellum is being relayed to thalamus. There, basal ganglia information and thalamic information, they will be computed together, and then final decision will go up. That we will talk later, right? Let's come back. Any question up to this? So it's so easy to understand. When you are resting, these blue neurons are overfiring, lot of GABA in thalamic nuclei. Thalamic nuclei inhibited, thalamocortical fibers inhibited, no stimulation to the downgoing corticospinal corticonuclear fibers. But when movement, you are planning for a movement, first of all, corticostriatal fibers, which are glutamatergic fiber, stimulate the striatal neuron. And striatal neurons, when they get stimulated, this pathway releases GABA in globus pallidus internus, neurons in globus pallidus internus get inhibited, then pallidothalamic pathway, oh my god, yes, this get inhibited. So pallidothalamic pathway does not release GABA in thalamic system. And when inhibitory neuron is deficient here, then thalamic neurons are released from the inhibition and they fire upward, right, to the cortex. Of course, what is this? This is going to premotor cortex, supplementary motor cortex, primary motor area and somatosensory area. And there, the neurons which are going down, they are activated. Any question here? This is called direct pathway, right? Now we'll come to that fussy thing about indirect pathway. What is indirect pathway? Let me tell you. There is one more pathway when we start for the movement, and let me tell you why we need two pathways. Listen. Let's suppose my hand is like this. Okay, my hand is like this and I want to close it. Right? So motor planning should be of two types. Number one, flexors should contract. Number two, extensors should relax. Are you understanding? Even when you are going to do any movement, your posture should be adjusted, right? And tone in other muscles where active movement is not done also need to be adjusted. Is that right? For example, right now, if you are writing something, try to write. Not only your hand muscles will change their movement, but you will find shoulder also has change in the tone. Try it. Try to write something. It means actually Basically, this is a function of the basal ganglia. We originally in our mind, we planned to write something with the hand. But why all this tone and postural platform is altered? This is also all planning by the basal ganglia. Is that right? Now, one thing which is important, as I told you, that if I have to close my hand, flexors should contract, but at the same time, extensor should relax. It means basal ganglia should have two pathways. One pathway should be stimulatory to some muscle group. Another pathway should be inhibitory to other group. It means agonist should be stimulated and antagonist should be inhibited. It means there should be one more pathway because this pathway is only stimulatory. Now we'll talk about the second pathway. Look here. This is when we are planning for the movement. Another pathway here, it is initially it is the same. What is it? Corticostriatal fibers. From these are glutamatergic fibers, and from here fibers go to globus pallidus externus, not internus. You see, this is going all the way globus pallidus internus, the direct pathway. But when we talk about indirect pathway, the fibers from striatum go only to the globus pallidus externus. From there, the next neuron, they go to, what is this? Subthalamus, right? And then from subthalamus, glutamatergic neuron go to, what is this? Pallidum. And from the pallidum, globus pallidus internus now, neurons are going to thalamus. Now, this pathway involves an extra loop. Here the fibers are going from striatum, listen, from striatum directly to globus pallidus internum. So this pathway was direct pathway. Here the fibers are going from striatum to externum, globus pallidus externum, via the subthalamus, go to the globus pallidus internum, right? So, look. Striatum is influencing the output of globus pallidus internum directly or indirectly via subthalamus. So that is why this pathway is called direct pathway and this is called indirect circuit or indirect loop or indirect pathway. Am I clear? So what is indirect pathway? Where striatum is influencing the activity of globus pallidus internum indirectly via a loop through subthalamus. Is that right? Now how this pathway work? Again, the corticostriatal fibers are glutamatergic and they will stimulate. So again, these fibers are what? When you are planning the movement, these are stimulated. Action potentials are more in these glutamatergic fibers, but these glutamatergic fibers are different than the previous fibers because these fibers end up on such striatal neurons which go only up to globus pallidus externum, right? So they will stimulate first these blue neurons, and when these blue neurons will be stimulated, their activity will increase. Is that right? But what they will release on the next neuron? Yes? What they will release? These neurons will release GABA. When GABA will be released, what will happen to the activity of this neuron? It will be inhibited. So we can say activity in this neuron is less. When activity is less in this neuron, right, which is globus pallidus externus to subthalamus, when it is less active, it is releasing less GABA on these neurons, right? When it is releasing less GABA, it means this is less inhibitory. Is that right? So it means this will be released from inhibition. And when these fibers, which are subthalamopollidal fiber, when these fibers are having less GABA influence, they are having less inhibition, or we say they are disinhibited, so or they are released from the inhibition, so they overfire. And when these fibers will overfire, they will release a lot of, what is this, glutamate in which area? Globus pallidus internum. And when there is glutamate released, that will stimulate this pathway. And when this is stimulated, oh my God, yes, that's right. These fibers will be stimulated. So they will produce more GABA, where? In thalamic nuclei. And when there will be more GABA, what will happen to this neuron? This will be stimulated or inhibited? That will be inhibited. And this will be connected with some those system which need to be inhibited. Maybe in this example, this pathway is bringing information eventually to the extensors. So extensors will be inhibited. You are understanding? No problem in this? Why you are looking so happy? You are understanding it? Okay, that's good. I'm happy for you. Now, again, start the direct pathway and then we'll discuss the indirect pathway, then we'll make their comparisons, right? Direct pathway is, now you people will tell me, cortico-striatal fibers, right? But real difference is from here, that from striatum, GABAergic fiber are directly connected to globus pallidus internus, and from there, fibers are connected to the thalamic nuclei. What is happening? When direct pathway is activated, cortico-striatal fibers release glutamate, stimulate the striopallidal fiber, stimulated striopallidal fiber, which are GABAergic fibers with release of the substance P, they release GABA on internal pallidus, globus pallidus internus neurons. Those neurons are inhibited, and when they are inhibited, they don't release GABA in the thalamus. So thalamic neurons are not inhibited, so they will be overfiring. And when thalamic fibers, which are thalamocortical fibers, they're overfiring, when they will go up, they will stimulate the upper motor neurons. Is that right? For one group of muscles, maybe suppose here flexors. Clear? At the same time, we need to inhibit some other neurons. So we can say, first of all, indirect pathway. Indirect pathway, when it is overfiring, cortico-striatal, what will happen? It will stimulate GABAergic neurons which are going from striatum to externum pallidum. They will inhibit the fibers which are going from, pallido subthalamic, and there is less release of GABA release in the subthalamus. So subthalamic neurons are not inhibited anymore. They overfire and release glutamate in globus pallidus internum, and glutamate stimulates the inhibitory fibers, GABAergic fiber going to the thalamus, and they release a lot of GABA and inhibit these thalamic neurons, and these thalamocortical connections are inhibitory. So what did we see? Direct pathway, when it is stimulated, it is stimulatory. Indirect pathway is basically inhibitory. Is that right? Now let's compare and contrast direct and indirect. First of all, direct pathway is shorter pathway and does not involve subthalamus. Indirect pathway is longer pathway and involves the subthalamic connection. Direct pathway, when stimulated, eventually it stimulates the thalamocortical fibers. So it is for movement activation. Indirect pathway, when it is activated, it actually inhibits the thalamocortical. Some of the, of course, these will be different fiber, those will be different. It inhibits the thalamocortical fibers to inhibit certain upper motor neurons. Is that right? Any question here? There is no problem.